Let's get our speakers onto the stage. We have Marwan, Abdulaziz, Janahi, the Senior Vice President at Dubai Science Park, Dubai Knowledge Park, and Dubai International Academic City TECOM Group. Dr. Ramadan Alblooshi, the Senior Advisor and Director of Public Health at Dubai Health Authority. Dr. Heidar, Arjomand, the Group Chief Medical Officer at Medical American Hospital, Dubai, and your moderator, Ramia, Farrage, Senior Presenter at Forbes Middle East.
So much. Thank you so much, Sally. Hello, everyone. Isn't it a beautiful evening? And we are so excited to be back at the Medical Tourism and Wellness Summit for the second year in a row. Our panel, we're talking about medical value travel. This means high quality care, plus cost effectiveness, plus wellness, plus recovery benefits. It's a lot to deal with, isn't it, gentlemen? And it's so nice to have you here. Mr. Janahi, tell us first how Dubai Science Park's collaborative ecosystem is really accelerating innovations in robotics and in AI diagnostics and precision therapies to strengthen Dubai's medical value travel offering.
Well, thank you firstly for the organizers for inviting me to be part of this amazing event. It's very nice to be here outdoors, meeting lots of familiar faces and also new faces. At Dubai Science Park, we look at two sides of things. One is the build element, which is the facilities. So you can think about it from lab to manufacturing, everything in between. But that is only the building blocks. What we need, what is more important, I think, is also the human element. So what are the, how will people be using those services and spaces? How are they connected to each other? How do they discuss future projects? And how do they connect to the wider ecosystem, which is the government being the regulator, the academia being the universities, and also the industry that is represented with large companies, multinationals, and also startups. So putting the building blocks together and also being the glue in between is how we basically make things happen.
It really shows how ecosystem collaboration can fast-track clinical innovation. And Dr. Ramadan, how is Dubai's regulatory framework adapting to safely integrate robotics and AI diagnostics and emerging therapies for the medical travelers who seek to come to Dubai?
Thank you very much for hosting me for this nice, lovely evening. And again, familiar faces always here. I think the government of Dubai, when we talk about, maybe Marwan mentioned regulations, is that what are the guidelines and laws which have been published in the country. So been a lot of, lately, a lot of laws, especially in AI. Maybe UAE, we are lucky that our leaders were also encouraging us all the time to issue some regulations and laws. So we are lucky that the first law was issued. Secondly, that Dubai, as per Dubai also, we have issued a lot of policies. One of them is concern AI policies and how to be used in the practice in the clinics. A lot of clinics were asking what is AI, how to be implemented. So that was the case. Thirdly was some examples. I'll give you an example, which is telemedicine, for example. Telemedicine now today started during the pandemic, but the regulations were not clear. Dubai was one of the first cities to start regulating this one by enhancing this one, encouraging such policies. So when you talk about robotics, AI, blockchain, it's something new to Dubai because the laws and regulations are there. Lastly is the how resilient Dubai is in implementing those laws, because it's not about black and white. It is what is good for the business. On top of that is the patient privacy, ethicals, and protecting the patient all the time.
And regulation is really the backbone of patient trust here, isn't it? Dr. Heidar, high-tech care demands constant upskilling, as you know very well at American Hospital Dubai. How do you build the training culture and the mental resilience needed for clinicians to excel in advanced robotics and AI?
Excellent question. First of all, thank you for having me at this great venue. I think there are several aspects to building a tough, resilient system. I think it starts with organization. and organization, leadership, and the team. You know, there's an old proverb that if you want to go fast, you go alone, but if you want to go far, you go together. And building a team, having the right leadership in place. I think that's the most important thing. Second is providing a safety culture, both to grow and also if there are errors to be improved. And number three, we have to have a continuous training pathway. Medicine is always resembled aviation. Aviation industry is one of the safest, and we need to strive to be as safe as aviation in this industry. Emirates Airlines, not all airlines. In order to be as safe as aviation, we need to have a continuous training pathway, and we need to be able to measure the measurable. And those measurables should count as our KPIs from leadership to every single member. And that's how mental toughness and resilience of a system come about.
Technology only succeeds when people are empowered to use it correctly. Isn't that the case?
Absolutely.
And Mr. Janahi, tell us about what Dubai Science Park is doing to strengthen the talent pipeline. I mean, clinicians, engineers, and tech specialists, which really need to deliver care at scale.
Right. So with Dubai Science Park, I have another hat with the higher education that is represented in Dubai Knowledge Park and Dubai International Academic City. So these two other zones are home to more than 30 universities and close to 38,000 students, which represents about 80% of Dubai's international student body. So with the other hat that I have, with the higher education, I always try to link the higher education and the outcome of what students study in college and universities to be linked with the industry. I've spent, many years at Dubai Science Park, almost from the beginning, but now that I also work with universities, such as Manchester University that is here.
The lovely Randa representing Manchester.
Randa, yes. So the link to industry through academia is very important, and we are trying to activate that through hackathons, internships, projects, and also working again with the government through something called RDI, Research, Development, and Innovation, that is by DFF. We are activating that triple helix model, which is government, academia, and industry. So that is very important. We need to be definitely aligned on what are the verticals that are important for the future and engaging students as soon as possible. And sometimes I even say from high school. It's very important because they need to imagine what is possible down the line.
And probably the UAE and Dubai in particular are one of the only places where students in high school are already being prepared for these types of challenges and the turning tides of the employment sector, which is a subject of another panel, which we could perhaps have you on in the near future. Dr. Ramadan, as medical technologies advance, what policy shifts are really needed to ensure that these therapies are accessible and are scalable and are trusted by both local patients who are familiar with this market, but international patients as well?
As we know today, Dubai is a hub for medical tourism, but before that it was a hub also for starting business in Dubai. So what makes Dubai unique is that Dubai succeeded in building the trust between the client and the system. So when you talk about Dubai, it's basically building a right ecosystem. As Mr. Marwan mentioned, the ecosystem is not only hospitals, but you should have education arm, research arm, and hospital. If this triangle is completed, then it will create not only a safeguard for the patient, even for the doctors to bring them abroad, to bring high talented doctor from abroad. It's not easy. So once you have this ecosystem ready in the country, they will definitely come, and then the patients will follow. Secondly, is that the policies which I mentioned earlier should be resilient. We used to talk about licensing, then we moved to regulation, and then we moved to agility. Now we're going to resilience. What's coming next after resilience is they call it extended resilience, which is Dubai also seeking. So all of these guidance policies, once being adaptive to what's happening to the globally and around us, it what makes Dubai unique and attracts more business. At the same time, it created a stronger and robust trust between us and the patients.
So policy must really advance as fast as the science to maintain this global competitiveness. And Dr. Heidar, how is American Hospital Dubai integrating advanced robotics and AI to meet rising expectations for advanced tech for medical tourism?
Well, excellent. So I think obviously we're part here for medical tourism. I think the most important factor, which Mr. Sharif Bashara mentioned in the previous panel, was quality of care. So I think in Dubai, we strive to provide the highest quality of care because the saying goes that quality brings quantity. So if you want patient to come to Dubai and increase the percentage of medical tourism, is providing the highest quality of care. And that's what we aim and do at American Hospital. Second, American Hospital was one of the earliest first place to get a dedicated center of excellence for robotic and robotic surgery. And it's not only important to have robotic surgery, but to have early adoption of technology. And also be widespread. It should not be limited to one surgical modality. We currently provide robotic surgery in the field of general colorectal surgery, urologic surgery, breast surgery, obstetric gynecology surgery, and soon cardiac surgery. So all of those combined become the backbone of what help us to provide high quality care. And this is on the top of what the AI models help us to be able to predict risk pathways. So by profession, I'm an interventional cardiologist. I wake up 2 o'clock in the morning to do an emergent procedure on someone who has a heart attack. Before, 10 years ago, we were going through training and we were learning on the job how to do this. But now, with AI integrated system, with virtual reality simulation based, essentially an interventional cardiologist can complete 100 procedures before risking one single life. And I think that's where we're going with quality of care and we attracting medical tourism to Dubai.
The benefits are incredible and all-encompassing. And we are running out of time, but one final question to all panelists. How can hospitals and regulators and innovation hubs, we have all three represented on stage today, work together to ensure that robotics and AI and new therapies really improve outcomes and strengthen Dubai's reputation as a trusted, high-value medical travel destination? We have 1.5 minutes.
It's a long question, but I'll keep it very simple. I think the key thing is to keep the patient at the heart of what we do and keep in mind that we need to do that through collaboration.
My answer is simple. It's already happening. So the only thing is happened by more collaboration, more clarity, and the infrastructure is already helping them to integrate. If you want to succeed, you have to succeed together. If you want to be working alone, you will never succeed, especially in Dubai.
I think within the frame of the regulatory rules and the patient at the center, at the heart of the matter, is emphasizing quality of care, because attention to details and high quality of care what separates American Hospital, what separates Dubai from many other tourism destinations.
I think it's really clear that today's discussion shows the future of elective care in Dubai really depends on innovation, on regulation, and clinical excellence working in harmony, as our panelists have been in their history in Dubai and will continue to in the future and during today's discussion. Thank you very much for being here. I appreciate your inputs. Thank you.